Welcome, this is To The Root podcast, brought to you by Transitions of Indiana and We Grow Hair Indy, where we get to the root of hair restoration solutions, navigating hair loss, embracing life's journey, and everything in between. Welcome back to The Root podcast. I'm joined by Nate Schaefer. Nate, good to see you again.
Happy to be here.
Thank you for being back here. It's the first week of April. One of the favourite times of the year for me, March Madness, finishing up or just finished up. Love it. Favourite time of year, look forward to it every year. Today's a good topic, the day of your hair transplant. I always joke because I walk in the morning of the procedure and I say to the patient, "Are you ready to go?" The patient looks at me and goes, "I think so." And I say, "Well, that's good enough for me." Everybody's nervous that day. Yep. I'm sure you were. I was. I think anyone that says they're not, they're lying.
Right.
But preparation equals performance, right? And I think just leading into what happens that day, when I had my procedure 20 years ago, I remember getting there on procedure day and realizing, well, it's actually happening.
Right.
I didn't feel very prepared. So I think one of the things we've tried to do in taking that experience is, and I touched on it before, is, you get paperwork and content on what to expect leading to. So I think for the most part, our patients come in kind of knowing how the day's going to go, which kind of lowers the nervousness. Right. And I also say to guys, look, we've been doing this for nearly 20 years.
Right.
This is all our teams do. Relax, sit back, let us take the stress off you. Let's get you through the day. And the day always goes faster than what you think.
Yeah.
So we're not going to get into it here, but we spend a lot of time on guiding guys through on what to expect up to the day of the procedure and morning of the procedure before you walk in, limitations around food or what you're putting in your stomach. Anything that we should know of?
Well, we don't want you having any alcohol that morning, which I mean,
it's probably. It's happened before.
Yes. You wouldn't think you'd have to specify, but
it has happened before.
It's not common.
No coffee.
Right.
Nothing that's a stimulant.
Yeah.
Right. You have a certain shampoo to use.
Yes.
Right. You have that antibacterial wash. We used to use antibiotics prophylactically, but the scalp's such a vascular area.
Yep.
We use that wash. We use the pre-wash,
right,
antibacterial pre-wash. So you'll have that to wash with that morning.
First thing you're going to do is meet the medical staff. And they'll take you into the pre-procedure room, fill out some paperwork. We make sure that you've had some food, right? Ask you if you need any water, anything to drink. What would you say? That's about 35, 40 minutes into the paperwork, whatnot. You'll meet with the physician.
Yep.
Goes over any questions.
Pre-procedure paperwork's done. Physician has kind of reviewed medical history again with you. Time for hairline design. This is where the art starts to come into play. Talk us through that a little bit.
Well, this is exciting, right? I mean, everyone, I feel like when I'm meeting with someone, they always want to see, where would you put the hairline? I mean, I get that question all the time. And what does everyone think? Here's a picture of me before I lost hair.
Right.
And it's a 44-year-old, and he was 18 in this photo. It's like, well, we can't use that hairline, right? Your facial structure changes, your temples may recede as you age, and that is completely natural, right? So the hairline design isn't always a representation of what you would look like with no hair loss.
Right.
It's something that's age appropriate to basically mimic where would your hairline be naturally right now for your age.
Yes.
Right? So there's a few different ways you can come to this. A common one that we use is facial measurements, okay? Bottom of the chin, bottom of the nose, this measurement up from the glabellum or the brow ridge. A lot of the times you won't see a hairline lower than 7 centimeters from the brow ridge, but sometimes we'll do a combination of measurements, and we come to this. And the amount of curvature on a hairline is typically dictated by where their temples sit. If a temple's further forward, you don't need as much curvature on the hairline. If the temples are recessed and they're further back, you have to put more curvature on there.
Yeah.
So a lot of it is just your unique situation kind of tells us where that hairline needs to go.
Yeah, how wide the eyes are apart as well.
Right.
It kind of determines how broad the frontal hairline is. And I heard a good saying a few years ago, the good thing about a hair transplant is it's permanent. The bad thing about a hair transplant, if it's in the wrong place, it's permanent. Right? So this is a permanent thing we're doing. We guarantee the hair to grow. It's going to grow. So you have to have a situation where the hairline complements the face. It doesn't dominate it.
Right.
And we see some of these hairlines on YouTube, and I've seen it. You've seen it. We've both seen it, where guys come into the clinic and they've had transplants done somewhere else. It's almost like, respectfully, the physician that was doing the procedure gave
Yes.
the China marker to the patient and said, show me what you want. And they've drawn the hairline and the patient doesn't know any better. Our job is to educate, but also to protect the patient from something they don't necessarily know that could be a problem down the road.
Right.
Future hair loss, facial structure changing. How long does it normally take to draw that hairline? And I also notice our docs will often do a couple of different ones. So they'll show you, hey, here's how this will look, here's how this will look. And often the best thing to do is say, what do you think is best, doc?
Right. Yeah.
And so I love watching them draw the hairlines. It's neat.
15, 20 minutes sometimes to really mark out that hairline.
Yes.
But the conversation surrounding the hairline can take a little longer.
Yes.
Than that.
Yeah.
But to actually put the hairline on in a good place, 15, 20 minutes sometimes, sometimes less.
Yeah.
But usually there's a conversation around it.
Sure. And we take photographs so that we've got those, because you forget, how often have I done a follow-up, we actually forget that, hey, that was my hairline. And so you see it afterwards, and it's very, very helpful. And often there's a spouse or someone that's also kind of is involved with that hairline design. So that's so you're right, hairline design, a little bit of review of the game plan, procedure itself. Okay, talk us through that. Talk us through the steps around actually getting the hair transplanted.
Like when they move from the pre-procedure suite into the well, generally we'll shave down a small area in the back of the scalp where the tissue is going to be harvested. If we're doing a multi-unit procedure, we may trim some of the recipient areas where those are. Get you in a gown, right? So we typically tell the patients to wear a button-down shirt, so that can be easily removed. We're not pulling any clothing over the top of the scalp after the procedure. Get you into the procedure suite. From there, we generally get you seated, administer a light sedative, okay? Make sure things are comfortable. And the procedure commences from there. I mean, we start to inject the area with some tumescence, mark out the areas, physician begins harvesting tissue, we get the technical team involved, we start dissecting grafts.
I always explain to the patient that the first hour and a half seems like 30 seconds.
Right.
And that's the magic of conscious sedation. I mean, when I had my procedure, we didn't use it back then. So patience is not one of my strong points. So I was worried I could actually sit in the chair that long. But the sedative we use now makes time go faster because it has that slight amnesia effect to it. And the great thing about it is before you really know what's going on, you're an hour and a half or 2 hours in, we've harvested the donor hair, whether it's multi-unit hair grafting or ARTAS Robotic FUE. The sites have been made to place the grafts. We've done the closure in the back, and they're placing grafts. So guys are always like, have we started yet?
Yeah.
And they're already placing grafts.
Yeah. Most of the time, by the time the patient gets their wits about them and they're asking questions, we're planting grafts and it's almost over.
And a lot of guys ask, am I awake? Well, conscious sedation, you can doze off to sleep. You can also be in a situation where you're talking, you're having a chat, we don't really know you are. So if we ask a question, we get a silly answer. But I always talk about the 4 phases. Harvesting the donor, it's about half an hour. Making the sites to place the grafts, which the physician does, while simultaneously the nurses and technicians dissect the grafts up into the number and type of grafts the physician has requested. So that's happening at the same time. Then about an hour and a half in, they meet in the middle and put the follicles in the little tiny incisions the physician has made. So that's sort of multi-unit hair grafting. FUE, let's talk about ARTAS Robotic FUE. How does that day?
Well, it's a much longer day.
It is. It is.
Patient generally gets seated in the robotic procedure. Now, sometimes we'll actually extract the grafts first from the donor area, and sometimes we actually make sites first. This is sort of up to the physician at the time, depends on the size of the case, type of donor hair that we're dealing with.
We do have to prep the donor area, so the imaging system on the robot, or even if we're doing it manually, you want the hair short so you can see the angles that the hairs protrude from the scalp. So we want to take that down short. If you've got any grey hair in there, then we put a temporary colour on the hair. So if I was having an FUE procedure, I'd have to put a temporary colour on my hair, which is there for 12 to 24 hours. So so that again you can pick up the hair follicles coming from the scalp, because the angles the follicles come from the scalp are really important to determine where that seed or bulb is under the surface. So you go and extract the follicle. We don't want to transect or damage that follicle, so we want to get our entry angle just right. So if we're harvesting first, then the robot, guided by the physician and the team, basically gets directions around mapping out the number of follicles we want, the type of follicles, and it works across a grid on the back of the scalp. We're getting real-time feedback on a large screen up on the wall where we're seeing the number of follicles we've taken, where it's been, where it's going next, the density, the number of follicular units per square centimetre, and we just the robot works across this grid. Once we've got what we want from that grid, the grid gets moved to a different part of the donor area, and we harvest there. So the importance of that is it's making sure we're not over-harvesting in the donor area. And in this scenario, if we harvest first, which sometimes we can make sites first, that harvesting takes about 2 to 2.5 hours. We'll break for lunch, or the patient will break for lunch, and then while he's having lunch, because you've pre-ordered before we start, one of the nurses, under magnification, puts all the different grafts or groupings into their various grouping types. Smaller ones in groupings, they'll be in the front of the hairline, the larger ones behind it. And then the physician, after lunch, physician makes the sites. So we'll numb the area, makes the sites to place the grafts. Team come in, meet in the middle, place the grafts. Generally, you're done if you arrive at 8 o'clock in the morning, between 4 and 5 o'clock. Yeah. There's a little variation around that. You need someone to drive you home afterwards because you've had a mild sedative, of course. So whoever's going to come and pick you up, we'll give them a call an hour before you're done. And FUE, there are variances around that. Like we said, sometimes we won't always harvest first. Sometimes we'll make sites first. The hair type and colour plays more of a part with FUE. So there are certain types of hair that aren't quite as well suited to FUE.
Right. Combination of manual FUE with the robot as well.
Yep. Yeah, and I think that's important, isn't it?
Blending around the field.
Yeah, and sometimes certain hair types, anything is anything you do, you have to be fluid, right? And so we want to be fluid around if we start a procedure and we're doing ARTAS robotic FUE and we feel like it's great to finish up harvesting a few manual grafts, sometimes that'll be done. The physician will make that call. There are certain cases that are more suited to one than the other.
Right.
So having those arrows in your quiver, I guess, is really important. Having the different types of FUE, just like it's important to have FUE and FUT in your clinic. When you leave the procedure, we take you to the post-procedure room.
Right.
Cookies, some sustenance, some electrolytes, game plan for tonight where we go over those directions. And it's always nice when they're there and we go over the directions that night. We do call and check in on you, of course, that night as well. Right. If you come by yourself, we've got a cab or Uber system we can grab, have someone come grab you, take you over to the hotel. We've got a couple of hotels set up really close. A lot of guys from out of town because, of course, we want to see guys the next day. Night of the procedure, really it's not too dissimilar to multi-unit hair grafting. It's the same,
Stay up late.
Don't
bump your head.
Don't bump your head, yep.
Neck pillow is super helpful.
Yeah.
Take medication as needed.
Yep.
And just try to get comfortable.
Yes.
And wait out the night.
Yeah. Yep.
And we'll see you in the morning, basically.
And you can have a little bit of fluid retention
on
the forehead, which is, again, it's not a medical issue, it's a cosmetic one. And that's just gravity taking over because the tumescence that's injected here to puff the tissue up, to numb the scalp, starts to drain down because gravity kicks in, right? Mm-hmm. And then the next day, of course, you're back for us to wash and check the transplant area. Driving
yourself in that next day.
Totally fine to drive the next day, smooth day. The team are phenomenal and they just make it smooth. And before you know it, again, a little bit of the mild sedative early in the day. Before you know it, day's over.
I feel like you're back there for, most guys will say 3-4 hours maybe.
It's crazy.
Maybe.
Yeah. And multi-unit hair grafting, it's even faster.
Oh, yeah. Yeah, you feel like you're back there for maybe an hour.
It's wild. Yeah. Right. But when you've done it as many times as we have, we guide you through. And we know the guys that are more nervous than others.
Yeah.
Don't we? I mean, you do. It's human nature.
I was one of them.
Yeah.
I mean, I was, I don't want to say terrified, but I was pretty worried that morning. I mean, you're just, can't believe I'm doing this.
Right.
You know what I mean?
Right. So thinking back to that, what did you keep saying to yourself to get yourself through to being, I'm sure you woke up that morning and go, oh man, I've got it.
Well, what everybody's worried about is the way they look.
Yep.
Right? Is what am I going to look like immediately?
So if you wasn't going through the procedure, it's what I'm going to look like.
Yeah, that's what my thought was.
Yes.
What am I going to look like immediately after this? Right? The most effective way I got through this was, I don't like the way it looks now.
Yeah.
So I was like, well, every time I look in the mirror right now, I mean, it bothers me. So yeah, this is just going to be a different type of bother, but I'm in the same boat.
Yeah.
The difference is, once I have this done, a few months down the road, things are going to be looking really good.
Yeah, someone once said to me, nothing ever changes until you get started.
Right.
And it's very true.
Yeah.
It's very true.
Yeah.
Anything else that comes to mind? If I'm a novice and I'm preparing for the day of my procedure, what else would you say to me?
Make sure you're wearing a button-down shirt. That's more important than you think. A neck pillow is so important. I mean, it'll make your life so much easier than trying to stack pillows. Mm-hmm. If you can get it into a recliner, get into a recliner. Those things will be very helpful.
Talk to us about why the neck pillow is important.
Two things. First and foremost, you don't want to bump your head in the middle of the night. I mean, you're unconscious. You don't think about it. Most guys are...
You're asleep.
Yeah.
You mean?
They're just falsely confident. No, I won't bump my head. It's
yeah.
You know, you don't know until you do it, and then you're going to forget that you just had a transplant maybe,
and that
right?
that Murphy's Law thing always kicks in.
Yes.
That's like, it's like when you're dressed up, you're going somewhere and you drop something on your shirt. You know, like, oh, it's my favorite shirt.
Guy bumps his head on the car, getting into his car, knocks a graft out. What will he tell you? He says, I've never hit my head on a car in my entire life. It just happened today, right?
Yeah.
The neck pillow is really important because it just keeps your head stable, helps with some of the fluid drainage. It also
drains away evenly, doesn't it? Yeah.
And it's way more comfortable. Mm-hmm. I mean, it just helps you get through the night. Mm-hmm. Those first 2 days are probably the hardest. And every little bit counts. Mm-hmm. And a little bit of a neck pillow, don't underestimate the help that gives you to just get some further relaxation and get some sleep in those first 2 days.
Yeah, and I think particularly as you get older, you're not there yet, but what you do throughout the day dictates how you sleep at night. Right? When you're young and you're in your 20s or you're a teenager, doesn't matter what you do, you go to bed and you sleep great. But as we get older, certain things dictate how you sleep. What you do during the day dictates how you sleep later that day. Well, the same thing leading up to a hair transplant. Like leading up those few days before the procedure, make sure you're well hydrated, look after yourself, no alcohol, don't work out the day before. All these things are going to give you a better experience that day, and you're going to be more relaxed and chilled and get a little bit more rest the night of the procedure. I'm a horrible sleeper, so it's really hard for me to sleep upright. I ended up taking some melatonin, getting the U-shaped travel pillow, and I did sleep a little bit that night. Some of the physicians. One of the physicians we had, I've worked with him so long, I know exactly what he would say. He'd walk in after surgery and look at it and say, well, we've done our part, the rest is up to you. I'll see you tomorrow with all your grafts. And the patient would be like, oh my God, pressure's on, right?
Yeah.
And that's kind of the way it is, isn't it? You've got to be aware that the scalp's delicate. And the scalp, to be fair, the scalp is very vascular, so it heals quickly.
Right. And
it's amazing, someone comes back the next day and the grafts are already embedding themselves really well. I get a question all the time, when can I not feel like, oh my God, if I knock or bump them, I'm going to damage a graft? Probably 2 or 3 days. Yeah. They're embedding pretty well at that point. If you knock it, it's not terminal to the graft.
Right.
So a little bit of planning, but we'll get you through the day. And before you know it,
got a lot of hair.
Got a lot of hair.
Starts growing in.
It does. Nate, this has been great.
Absolutely.
I think it's worth mentioning that on the website at We Grow Hair Indie, particularly the VIP pages, a lot of those VIPs, we track them from day of procedure. I know when I do a consultation, I'll use Gunner's one, I'll use Paul Poteet's one. Really helpful because it tracks them the whole way through, kind of helps you understand what's going to happen on procedure day. Yeah. But man, thank you again. It's been a lot of fun. Always enjoy these chats. It's always great when you learn something. And I always learn something when I talk to you. And it's part of what we do, right? We want to get better all the time.
Wonderful being here.
It's been great. Guys, thank you. Email us at info@wegrowhairindie.com with your questions or topics you want to cover. Head to our website to schedule your free consultation with one of our experts. I'm Darren Andrews. Thank you for listening. Catch you next time.